News Geelong on this Friday spring evening. Eating Disorders Australia and Victoria is the primary source of support information, community education and advocacy for people with eating disorders. Meryl Friend reports.
At City Hall this week there was a talk to parents and people that are suffering from eating disorders, giving us ideas on how to support those people and to help change their lives. We were speaking with Dr Naomi Crafty, who's an Education Officer with Eating Disorders Victoria.
Well, we know that the two biggest risk factors for developing eating disorders are body image dissatisfaction and fad dieting or excessive dieting. So we'll be talking mainly about those two risk factors today. So the fact that we have a big body dissatisfaction problem amongst Australian young people, in particular women, but young men as well. And so we'll be talking about some of the causes of body image dissatisfaction, how to recognise it, what to do about it, and then also the fact that a lot of people treat their own body image dissatisfaction by going on fad or radical diets and how they don't work, but not only don't they work, they're potentially dangerous. Not only can they lead to health problems like obesity and other health problems, but they can also cause eating disorders. So we'll be talking about what to look out for in young people who go on fad diets and alternatives to fad dieting, and just ways of increasing people's well-being and healthy eating.
So I suppose a lot of parents would probably be the ones that would be aimed at. So something specific that people should be looking out for?
Yes, we certainly should be looking out for people who have low self-esteem, in particular focused on their body, so we call that low body esteem. So people who really think that the solution to life's problems is to change their body shape. So we talk about, at Eating Disorders Victoria, we talk about celebrating diversity, the fact that people come in all shapes and sizes, and really we should learn to accept our genetic makeup and the size that we are. But within that, to learn to eat a healthy diet, do a moderate amount of exercise and feel good about ourselves for who we are.
For more information you can go to www.eatingdisorders.org.au. I'm Meryl Friend for News Geelong.
Thank you, Meryl. Tireless volunteers from around the Geelong and Surf Coast have kept their hands busy over the past months, providing homemade knitted items for Australian soldiers in Afghanistan, as Debbie Meaney reports.
The CWA has come up with a great idea to help the Afghanistani soldiers. They're knitting furiously beanies, scarves and socks. And I caught up with some of those involved to tell us about just why they're doing it and how people can get behind them.
Well, it came from one of our members who was visiting an elderly lady who was knitting for soldiers in Afghanistan, but she couldn't understand why her son kept asking for more beanies, and then she realised that he was giving them away, and this member was there and she said, well, perhaps we can help. So she came back to our conference and asked at the conference would we put this up as one of the things we do, projects, and it really went from there. Then we thought there was only about 30 soldiers over there. Then we found out there's 1,500 and that it gets to minus 28 to 30. It's very cold and they need some warmth because I believe they get one beanie when they go, which is not much if it's that cold and they don't have washing facilities like we have here, etc. So that's where it's gone, and it's just grown from being a little seed through to being an acorn, oak tree. It's just gone berserk.
Yes, and I guess you can't just provide 5 or 10 beanies. That wouldn't be very fair, would it?
No, it wouldn't. And we've also got to consider that we've also got girls over there as well. And being country women's, we're for the women. So we decided that we'll go for broke. So then we sort of had the Australian Country Spinners come on, and they've donated $18,000 worth of wool to us. The Bendigo Bank has also pledged wool for us, and they're collecting them and delivering them to us, which is just fabulous. And I've had beanies come from North Queensland, New South Wales, Adelaide, Tasmania, South Australia, you name it. They're coming from everywhere. And the Bendigo Bank is just, well, they've just been wonderful. There's these big boxes of beanies turning up at all ours.
So, Sue, you've been involved in this project as well. Your son has done a tour over there. He'd appreciate this kind of thing.
He does. He does appreciate it. When I told him what we were doing, he was overwhelmed by it, and he said they'll be very happy over there.
And you also include a little note. No names or anything, but just
names,
a little note.
No contact. That's right. So I know that they're being thought of over there, and people do appreciate what they're doing.
It's really hard to imagine that it really is that cold over there, that they need that. It just don't get that perception,
no,
do we?
We don't know, but it is that cold.
Not in a million years.
At the CWA and Boundary Road, this is Debbie Meaney for News Geelong.
Thank you, Debbie. Are You OK Day is a national day of action which aims to prevent suicide by encouraging Australians to connect with someone they care about and help stop little problems turning into big ones. Meryl Friend has more.
Thursday the 15th of September was Are You OK Day, a day when everybody's encouraged to ask people how they really are, and hopefully people can answer really truthfully. And then if they do need help, there's plenty of places you can go. We were able to speak with Tony Van Hammond to find out more.
Yeah, look, it's an annual day that we're quite proud of. Our Youth Future crew were heavily involved in 2009, and this is our third year. The apple is the Geelong symbol of the day, and it's about health, and it's about looking after each other, and it's about communication and connecting communities. So, each year we try and do something fun and trying to get the message out.
So it's about mental health and preventing suicide and helping people who are having issues. Now, it's easy enough for one day to say okay, but how do we keep it ongoing?
Look, I think that's part of the battle really, is to keep the conversation going. This day brings it to a forefront, but really, the conversation should be occurring every day. People should be very clear about, if somebody's not okay, where they can get help and seek support. So it's really important that out of this conversation, people feel more confident to be supportive, be there for each other, and to ensure others can get help.
So if someone says, no, I'm not okay, what's the best thing for us to do?
Sometimes just sit and listen and just be there, because sometimes people just need a friend. Otherwise, utilising your general practitioner, local health services, Barwon Health, Lifeline, there's websites, Kids Helpline, Men's Helpline. There is actually help out there, and so some people would prefer to see a person, others like websites and phone lines, and so being aware of those.
So, Tony, are you okay?
I am okay, but I'm looking forward to some sleep.
From Little Mallup Street, Meryl Friend, News Geelong.
Thank you, Meryl. This is News Geelong as we go to a break and return with sport and weather after this.